When we were designing the study, our goal was really to understand the biology and the brain basis of ADHD. So in other words, we were interested in understanding how the size and shapes of different brain structures might differ in children with ADHD as compared to children without ADHD. For 2 to 3 decades now, there's been a number of these types of studies that have used brain MRI scans to ask those types of questions. But we were in a fairly unique position to be able to study that with the largest sample of children with ADHD and without ADHD that's ever been studied. So we used data from a very large NIH study called the ABCD study, which is a national study that's enrolling over 10,000 children across the US. And in designing the study, they were very intentional in trying to make the sample representative of the US population. So representative in terms of socioeconomic background, race and ethnicity, girls and boys. And so that really allowed us to look at ADHD in a very large sample and in a representative sample. We were expecting to really confirm some of the findings that have been reported in the literature, going back 20, 30 years now. What we found really surprised us in that there were very few differences between children with ADHD compared to those without ADHD. In most of the brain regions that we looked at, the sizes and the shapes really were similar to children without ADHD. And there were only a few handful of regions where we found differences that were statistically significant. But even those differences, the magnitude of the difference was really quite small and quite less. The differences were fewer and smaller than what's ever been reported previously. One of the things that we were concerned about is that potentially the reason why we were not seeing these differences is because the kids were not being properly diagnosed. So one of the challenges that you have with large studies is that it's great when you have a very large sample size and you're working with lots and lots of kids. But sometimes as you increase your sample size, the quality of the data might not be as strong, or the diagnostic assessment might not be as accurate. So we took a number of measures to try to test that out and really make sure that the diagnostic information did seem accurate. We looked at different ways that ADHD can be diagnosed, different instruments that can be used to diagnose ADHD. We looked to see that the rates of ADHD in that whole ABCD sample were consistent with what we'd expect, that the distribution of boys versus girls with ADHD was what you would expect. All of those things really checked out to indicate that the diagnostics seem reasonable. And then the other thing that we did is we ran what are called simulations, where we tested out, what if 10% of the sample was misdiagnosed? What if 20% of the sample was misdiagnosed? And even when we had a large number, we simulated a large number of misdiagnoses, you still saw these very, very small and circumscribed effects. So we do think that our findings are real and not attributable to some misdiagnosis. ADHD is certainly a brain-based disorder. I don't think there should be any argument about that. But what we had hoped is that, given that it's a brain-based disorder, that we would be able to do things like get a brain MRI scan and diagnose ADHD based on that. And what our study, I think, really solidified is, at this point at least, with your typical MRI scan that looks at brain structure and brain shape, that really does not seem to be possible. There for sure are biological differences, but that type of structural MRI technology that we're using is just too crude of an instrument to really be able to pick up those differences. That we're going to need either better technology, better type of imaging technology to be able to diagnose ADHD that way. Or the other possibility is that ADHD is a very heterogeneous disorder. So we put it under this one category and call it ADHD, but very likely there's lots of different disorders within that umbrella category. And when we lump them all together, we're not able to really make sense of the brain MRI data. But if we can find more homogeneous groups, and when I say homogeneous, I mean homogeneous in terms of the biology of their disorder, then we're going to be in a much better position to be able to use things like MRI to diagnose ADHD.